So the section that we're going to work on now is going to be, again, the muscles of the thorax, but we're going to do the deep muscles. So this time we're going to go and not concentrate on the side that we've designated superficial, but go over to the other side, cut through the superficial muscles, and go to the deep muscles. So just a little review. Again, we have the xiphi humerales, we have the pectoralis minor, the pectoralis major, and the pecto antebrachialis. These are going to be very flat, band-like muscles, so what we're going to want to do is go underneath this border of the xiphi humerales, take the blunt probe, and just kind of wiggle it around underneath that xiphi humerales. You'll see the muscle lift up, and once we've loosened that band of muscle, we can easily take a pair of scissors, using the blunt probe as a guide, cut through the middle of the body of that muscle. We're doing this so we can leave the origins and insertions intact, so we can go back and reconstruct and figure out which muscle is which after we've cut through. So we've gone through the xiphi humerales. We're next going to go through the pectoralis minor. Depending on the age and sex of your cat, this muscle will be a little bit thicker, especially if you have older males that are neutered or unneutered. We'll cut through the pectoralis major and the pecto antebrachialis. So once we've cut through those muscles, go ahead and use your blunt probe. There may be some muscle tissue that still needs to be cut. And you can cut all the way through that thoracic region until you get to the cervical region. And then we'll start identifying our muscles. You'll notice there's a little bit of fascia here. Your probe should easily go through the fascia and stop at the level of the muscle. And these are key tips in dissection. You don't want to just cut through muscle. So free up as much as possible. You'll notice that there are these very tough white or cream colored strings. These are nervous tissue. They're nerves that are running from the ribs out to the other parts of muscle. So you'll go ahead and pull that back. You'll notice that some of these layers of muscle are not only separated by fascia, but they're separated by some layer of fat. Now, the first muscle that we need to find in the deep thoracic muscles are the scalenes, or the scalenes as a body. The scalenes is going to be located with its origin at the ribs and its insertion at the cervical vertebrae. Remember, cervical vertebrae are going to be in the neck region and associated along the dorsal side. So you're looking for a muscle that starts somewhere along the ribs, and if you rub your finger back and forth, you'll be able to feel the individual cat's ribs. So you look for the muscle that's going to run along that and kind of go back towards the ribs. Now, one muscle that you don't want to get confused with the scalenes is the transversus costarum. So, the transversus costarum is going to be the origin as the sternum and the insertion as the first rib. If you look here, you have a muscle that comes back and goes up and we'll go around to the back. So here's the scalenes, and I'll clean that up in a second. It's got two heads to it. And you have the transversus costarum. Remember, the transversus costarum is just coming from the sternum and going to the first rib. Again, you can palpate, feel the manubrium right here. So the body of the sternum all the way up to the first rib, which is going to be located just under the manubrium. So coming up here, transversus costarum. And I'll go ahead and put a white pin in the origin and closer up to the insertion. And the scalenes with its two heads, as far as you can see, I will put the yellow pin and designate where you should be able to see the heads of the scalenes. Clearing up a little bit of fascia here so you can see the designation a little bit better. Does everybody see this muscle? Again, moving a little bit of that fascia away. You have one head here and the other head there for your scalenes. Okay, the next muscle that we're going to look for is the serratus ventralis. This muscle becomes very apparent when you can finally get through some of this fat. If any of this nervous tissue is in your way, it's perfectly fine to just go ahead and snip it away and cut it. And looking for your serratus ventralis, you're going to look and see that the origin is the ribs and the insertion is the scapula. So since they're saying ribs as in plural, you want to look for a muscle that has a fan shape or many different origins. So if you notice, again, the ribs, you should be able to take a look and see that there are bellies of muscle that are located just a little more lateral than the two more medial muscles you were looking at before. And remember, medial is referring to the midline, lateral is referring to the body wall. And once you start seeing the belly of these muscles, you'll see that it's very fan-shaped, leading out to all of the different ribs that we were talking about. So you can see this fan-shaped muscle that goes out to the ribs, and all of that is leading back to the scapula. If you palpate just caudal to the femur, you'll feel the scapula. It's a very flat surface but very broad bone. It's like a hard plate surrounded by soft tissue that's muscle. So we'll go ahead and we'll pin the serratus ventralis. Which leads all the way back to the scapula. Hopefully you can see that fan shape. I'll go ahead and clean that up just a little bit more. That should help. You see that delineation and all of the muscle fibers that are running out from the ribs back to the scapula. Now, for the last muscle in this set, we have the levator scapulae. For the levator scapulae, you have the origin of the cervical vertebrae to the scapula. So we're looking for something that is leading from a more cranial position to a more caudal position, which means that we're going to look cranially from the serratus ventralis and over to this muscle. Now, you'll have to look deep underneath the scapula, and you'll see that there is this section of muscle right here. So the cervical vertebrae coming down here to the scapula, and all of these striations are coming in a kind of dorso-caudal position. We'll pin that with purple. So again, for your deep thoracic muscles, you have the transverse costarum, which is between the white pins, and you can see the body of that muscle right here. So you have the scalenus, which comes from this area right here with its two heads, comes up all the way to this point. So you can see these muscle bodies and the striations that go with it. You can then see the serratus ventralis, which again originates at the ribs and gives striations that come all the way back towards the scapula where it inserts. And you also have the levator scapulae, which starts in the cervical vertebrae on the dorsal area and moves forward to the underside of the scapula, designated by a purple pin. That's the end of the deep muscles of the thorax.